I'll be your MC for the morning, which means I've had 2 coffees and I should be conscious as we go through. And you'll hear a short talk from me just as an intro to the AI and medicine space for those of you who are new to it. Then we'll hear from Anthony Chang, who's currently in the US and treating patients right now. So I'm hoping he will be live when I'm finished. And then we'll cut to the main part of the morning, which is 3 presentations from clinicians about the challenges of doing work in their world as a basis for the Shark Tank, which you heard about. I've been in this space now for 30 years, which is a long time, and you see that the title of the talk was Entering the Time of AI. It's not that we're materially doing things in a different way, but the system is ready now for lots of reasons where it wasn't ready maybe 20 years ago to do this. We now have health records that are digitized, we have investment, etc. So let's just go through what's happening. And I think the big push has come from what's happened in the major tech companies, the Amazons, Googles, Apples, who have already used machine learning AI to optimize all the services you're used to, your Twitter feeds, your Facebook feeds, etc. And it makes sense that they look at healthcare, which is the largest vertical market, as another way. In healthcare, this is a slide of FDA, that's the Federal Drug Authority in the US, who approve devices and medicines. And you can see that in, I think, 2014, they approved 1 AI-based technology. And then in 16, they did 4 more. You can see by 17, there were 6. And last year, 23. So rapid growth in certification of new technologies in the US. So each of these represents a company investing money and taking a product through to certification, a very expensive process. And we haven't got the 19 figures yet. So a huge explosion in commercialization of the technologies. And the thing that has become very clear to me, literally in the last 2 or 3 months, is just how big a high-stakes game AI is in healthcare in terms of what industry is doing. I think the promise of the rewards of owning this market is so huge that there are quite large risks being taken in terms of investment. This is a slide, I think, which doesn't have last year's data, but shows you the growth in VC just in the US, number of deals and how much money's been spent. And overall, you can see there's about $6 billion expended in investment in this area in the US alone. 2 weeks ago, the largest ever capital raising occurred for a UK company called Babylon Health. Babylon's an interesting and controversial company, but they raised another $500 million, so they're now valued around $2 billion US. They're a company that specialises in digital-only primary care, and they're in the UK. They've got their eyes in Africa, and I know they're looking at New Zealand, and they might well come here too. So very big investment and a big expectation on return on that investment. And I'm also interested to see the appetite for loss. So if you know about Google or Alphabet, they've bought a company called DeepMind, which is very famous for doing very well at games like Go. And it lost $500 million last year, which seems like a lot of money, but then you have to remember Alphabet has about $115, $120 billion in cash alone. So if they stop making another dollar, they could do this for 200 years. So the willingness to invest and play long is very interesting. Now, I think the key point though in healthcare is that we're not looking for tech breakthroughs. The technology we have now and machine learning, AI methods, is already more than enough to transform the health system that we have. Our challenge is not more technology, it's the appropriate development of technology to support care. And I'm just going to give you one example to make that very clear. So, firstly, just to give you a pointer. So the use of AI spans everything from screening, like breast screening, prostate screening, through to helping make diagnosis, to picking treatments, to navigating the complexity of the system. And there are literally dozens of studies, really dating back 20 or more years, which show not just that these things are effective, but they improve patient outcomes and save money. So we know, well done, the technology makes a difference. And this is the point I was making about we're not designing algorithms, we're trying to design functioning systems, functioning health services, and it's a different thing. So this is the example. This comes from earlier this year. It's a paper in Lancet. It comes from China. a very impressive piece of research around deep learning and using that to diagnose thyroid cancer on ultrasound. What they managed to show was that they were able to equal or surpass human expertise in diagnosis, which is, I think, fantastic, another great win for deep learning. But then you need to think, well, what would the point be of doing that? We overdiagnose thyroid cancer. In South Korea, in the last 10 years, there's been a 15-fold increase in thyroid cancer. Oh my God, you say, everyone's getting cancer. No, they're just diagnosing more and more cases. The death rate hasn't changed. So we're just diagnosing a disease that doesn't need to be treated and treating people inappropriately. So what is the point of diagnosing even more people more precisely when the problem we've got is deciding who not to treat? So it's a good example of great algorithm, but not having thought through where it fits in the clinical world. Absolutely there will be a role for this sort of technology, but it needs to be embedded in a system that's rational and doesn't harm people, and in fact reduces the rate of radiation and surgery on people with thyroid disease. So what I like to talk about is what I call the last mile, not just for AI and healthcare, but for all digital things. And we always start with, wouldn't it be great to do X? And in our new AI world, we obsess about getting lots of data sets. To do your deep learning, you need lots and lots of data. A lot of work is invested there. People monetize data very much. Most of what I read in the last 2 or 3 years in healthcare has been what I would call in the middle mile, which is building those algorithms. Look how clever we are at being better than humans at these tasks. What very little attention has been paid to is the last mile, which is embedding this technology in the real world and solving real problems. And we know from the last 30 years of digital health that most of the challenge we face is in that last bit there. That all the benefits come when you actually invest in something that works. So if you have been involved in the electronic record world, you know how challenging it is to get people to like and use technology effectively. In the US, there's a huge challenge around burnout for clinicians who just cannot use these records, which add 2 to 3 hours a day, to their workloads. So for AI to succeed, we need to welcome and enjoy the technologies, but recognize the real challenges are going to be around understanding the business models, the clinical workflows, and picking the points where things are going to be actually valuable. And just I want to finish up now by just giving you a sense of where Australia is up to in this space. The English NHS is a great counterexample. So this slide says, it's from about a few weeks ago again, this is a very fast-moving space, that about £250 billion will be invested in a national AI lab in the National Health System in England alone. That's on top of a previous £1 billion investment in AI in terms of training and in clinical services, especially in cancer. Australia has not yet done anything of that order in this space, and so that's something that I've decided is a bit of a mission for me. And so we've set up this organisation, which you heard of before, called the Australian Alliance for AI in Healthcare, which essentially is a community building exercise. I cannot imagine that we're going to transform the health system with the aid of these technologies without involving a whole lot of players. We've got to involve government, we have to involve the end user, the consumer, got to involve clinicians, got to involve academia and industry. And so the Alliance really is now a way to bring these people together to start to understand what are the national challenges. So you heard at the very beginning about the importance of getting a correct ethical framework. So the Alliance is interested in 4 work areas. One is the ethics and safety of AI. It's one thing to say, look, I'm going to certify this app and I know it's safe, but if I've got a piece of technology that will learn and adapt through machine learning, what is the certification process for a technology that's not the same this week as it was last week? What is the ethical framework that allows us to deploy AI in a way that protects privacy, protects the interests of people, and makes sure that things don't happen to them that a human perhaps wouldn't have done because it wasn't the right thing to do. The other big challenge we have in this country is workforce. It's hard enough to find people in the digital health workforce. People in the AI space are even rarer. So we have a huge issue in terms of training, not just computer folks, but also clinicians who are smart users. A very good example of great work in the area comes from one of the Alliance members, which is the College of radiology, who have realised that the use of AI to interpret images is not the end of their profession, but their opportunity to basically take over half of healthcare. So they're thinking about how they change training of radiologists, what that means, and I really commend them. They've done a tremendous amount of work. They're way ahead of the other clinical specialties. And then there are two big areas I think we need to be supporting research, both at the practical level in terms of what works in the real world, as well as in terms of the more basic science, and that's around developing AI to support consumers. There's a big interest in supporting clinicians with diagnosis, but I think the biggest benefit is going to come from putting smart technologies in the hands of people to navigate and manage their own diseases. So that's a big area, and you'll hear a bit more about that from one of the Shark Tank pitches. And also, I think the other big piece, obviously, is investing in that clinical use of AI. So the Alliance is an organisation-based entity. So if you have an organisation that's interested in this space and wants to be part of it, just let me know. Send us an email. We're very happy to bring people in. We're doing our best to engage and work with government to see if we can get the levels of investment we think we need. But it's going to be a journey, as it always is when you talk to government. And there's a lot that we can do as a community in the meantime to start to get the conversation going.